Hello, my name is Dr. Dawn Ewing. I'm the Executive Director of the International Academy of Biological Dentistry and Medicine. This is Part 8 of Biological Hygiene. In this particular module, we're talking about gingivitis and periodontal disease. The plaque theory. Have you ever had a patient come in and say, "Forgive me for I've not flossed and brushed like I should have since my last visit"? You know that this embarrassment can be so traumatic that instead of returning more often, they actually return for fewer visits, and their visits are delayed. What if there's more to their problem? I used to subscribe to the theory, I did my job, now you do yours. If we did perfect surgery, if your gums still bleed, then it's the patient's fault. It's a negative approach which can lead some patients to simply give up. Home care does play a huge role, but it can be totally overridden by other factors. Can we improve their prognosis? Sometimes surgery is required to reduce the pockets. But if we overlook things like abnormal flora, medications, and nutrition, we're just simply setting the patient up for failure. Some drugs can cause problems. Dilantin, which causes tissue hypertrophy. Antihistamines or antihypertensives and diuretics can dry the mouth out, which promotes mouth breathing, which will dry mucosa membranes and promote bad bacterial growth. This drying can cause inflammation to the gums and cause rampant decay, also seen in patients that have head and neck radiation. We know the salivary gland function is diminished in those people. Use of antibiotics can cause yeast overgrowth. Thrush is commonly seen in infants. We look at female factors like hormone imbalances, replacements, contraceptives, monthly menses, and pregnancy can all cause inflammation. We all know about pregnancy gingivitis. What can a microscope reveal? Well, it can reveal abnormal flora or abnormal growth of normal flora, response of the immune system, and what if the patient has taken antibiotics? If we look at a healthy slide, we'll see red, round blood cells that are all symmetrical. We'll see white blood cells with active phagocytosis. We'll see long rods and spinning rods and fusiforms and cocci, as well as epithelial cells. When you see the small little round cocci, they can occur in chains or in pairs. So we've got streptococci, diplococci, the irregular clusters are staphylococci. Here is a picture of a healthy gum cell with a large nucleus in the center. The unhealthy slide. We see red blood cells that are irregularly shaped, white blood cells that are in unusually high numbers, an overgrowth of normal flora. Maybe we find an amoeba, or lots of yeast and fungi, or trichomonads. Here is a picture of an amoeba. Here are some images of yeast. Now, I want to caution you here that if you see some of these budded yeast, it may actually be that they had a bread or grain product for that day. So please don't diagnose from this slide. You can point out different things, but you almost need to have disclaimers in things like the candida. Don't tell someone they have candida based on the slide. You can say, I see budded yeast here, but maybe this is something that you ate today. In this particular slide, you see that the red blood cells are not nice and round. Actually, they're even indented in some places. You can almost make out some of the spirochetes that are kind of spiral shaped on here. I think we'll have another better image later. Here we see more spirochetes on the slide, but we also see the oval shape right to the right of this square, which is a trichomonad. It's a protozoa. It has a flagella in the front and the back. Here we see the 3 anterior flagella and 1 in the posterior region as well. This is just a blow up of the same protozoa. Really fun to look at a amoeba in motion. If you ever come to any of my seminars, you'll get to see them because I have some videos of them. They just take in everything. They morph like the blob and start to absorb things. Here's an image of another one. Here we see more spirochetes. We see that the red blood cells are dented. We see another trichomonads in here. The warm salt water, which is a hypertonic solution, is good to use if the cause of inflammation is due to something like calculus, because then you can remove the calculus and then you can create some dehydration of the tissue by using the salt water. Silver could be used after periodontal or cavitation surgery or extractions. It's anti-inflammatory, antiviral, antibacterial, antifungal, and analgesic. You could consider using some grapeseed extract. This grapefruit seed extract you want to make sure and dilute 1 drop per ounce of water, 4 ounces of water to 4 drops would make a good rinse. They would swish and empty, and then the very last sip they'll swish and swallow. You don't want to increase the concentration. This is not a time where more is better. I don't want to hear them call me up and tell me their gums fell off because they chose to put the grapefruit seed extract directly onto the toothbrush. It does have many, many good uses though. If you look at citricidal, usually it'll come with a little piece of paper or go online. They make a dental gel. You can sanitize your toothbrush. You can use it as a vegetable wash. It's a really good product. Some homeopathics which are good. Deseret Biological makes a homeopathic for amoeba and for gum problems. Vitamins, minerals, and herbs. CoQ10 is awesome. There's research out of Japan done with 100 milligrams a day. This is also good for your cardiac patients. If anyone is taking any type of a statin drug, then they're going to be depleted of CoQ, which you're going to see reflected in the periodontal tissue. Vitamin C helps form good collagen tissue, and I don't know of anything better than using something like a lipospheric vitamin C. Consider stress formula of B vitamins. Be careful when you're talking about B vitamins. You really want to look at the type of B that you're taking. A lot of people have MTHFR, which is a methylene tetrahydrofolate reductase. It's a genetic flaw that really doesn't allow them to absorb cyanocobalamin. So you'll look at the methyl form instead, and you would want to look at folate instead of folic acid. A short course of echinacea or bee propolis could be used if you see poor phagocytosis. Phagocytosis is the motion that's inside of the white blood cell. You want to see those tiny little dots dancing around and pulverizing what's inside. And if it's just a really slow motion, then you can improve that by a short 10-day course of echinacea and then come off of it. Calcium and magnesium are also helpful, and probiotics help increase the natural hydrogen peroxide levels. Other factors that are helpful are things like diet. Is the person sleeping enough? Are they drinking enough? What's their digestion like? Could there be malabsorption? What is their stress level? Maybe it's just sucking the B vitamins right out of them. Do they have blood sugar problems? This might be a case where you want to get the primary care involved and find out what a hemoglobin A1C is. We have documentation where hygienists have actually found cases of leukemia just simply by making notes of how many white blood cells were on there and it being not normal. So they just sent them out to their primary care. These are all things that we should take into consideration. Thrush is a fungus that thrives on high sugar levels in the saliva. So good control of sugar levels and good home care of the teeth and dentures can reduce the risk of thrush. A dry mouth is oftentimes found with our elderly patients, especially as they start taking more prescription drugs, or someone who's been diagnosed with Sjogren's or connective tissue diseases, lupus. It's often a symptom of undetected diabetes. Reduction of saliva can also increase the decay rate as well as mouth ulcers. Good control of glucose levels can prevent or relieve dry mouth caused by diabetes, but we also want to look at what our other options are for xerostomia, and we might want to include things like ozone. Gingivitis is seen when the gums are red and swollen and they bleed easily. It's, of course, the first stage of periodontal disease. Other risks involve things like smoking. A smoker with diabetes over the age of 45 is 20 times more likely to get severe gum disease. Of course, the diabetes already has a problem for the inside of the blood vessel, making it thicker. But the nicotine on top of that, the nicotine is a vasoconstrictor. So we're not getting enough blood to the gum tissue to even oxygenate it. So it starts having problems. Other contributing factors. Is the problem localized or is it generalized? If it's localized, it could be from a nickel crown, toxins from a root canal, cement left under a newly seeded crown, poor margin of a restoration, possibly from packing food between the teeth, maybe because the person's a mouth breather, an ill-fitting partial, or a burn or some trauma in that area. Is this problem acute or chronic? Acute conditions could be from a reaction to a new toothpaste, like one that has sodium lauryl sulfate, or a reaction to certain foods, or it could be a virus. In this case, you might want to use homeopathics or tea tree oil or a nanosilver. What should you do if they don't respond? This is when you write a letter to ask their physician to rule out certain diseases. Can they rule out diabetes or leukemia or reflux or self-purging? Has the patient suffered a stroke or lost dexterity in some form? So what is pH? Well, if it's acid, it's less than 7. Which is an increase in the hydrogen ions in a particular solution, whether it's saliva, urine, or blood. And if it's alkaline, it has a pH more than 7, which means that there's decreased hydrogen ions in a solution. The textbook of medical physiology says only a slight change in hydrogen ion concentration from the normal value will cause marked changes in the rates of chemical reactions in the cells, some being depressed and others being accelerated, which means that if you have a urine pH that is too acidic, because zinc is a pH-dependent mineral, zinc may not be absorbed in the body during the time that that urine pH is so acidic. pH effects on your entire body. The pH is reflective of the number of protons. That interferes with your energy level. It affects your immunity. It also affects your digestion. Salivary gastric bile secretions, pancreatic enzyme production, protein and carbohydrate metabolism, all are dependent on what the pH of the saliva are. Maintenance of mineral imbalance is also important. And the bone density. All of these things are affected by what your pH is. The pH affects the function of every cell, the health of the body at a cellular level. Too many cells die, and unfortunately, so do you. There's a tenfold difference between each whole number, which means that a pH of 6 is 10 times more acidic than 7, and 5 is 100 times more acidic than 7, and vice versa for alkalinity. So let's look at urine pH. when the urine strays from the ideal of 6.4 to 6.8. Digestive enzymes are not effective. If the pH goes even 1 point from ideal, most minerals will not be assimilated properly, like the example I told you in zinc. Zinc will only be assimilated if the urine is between 6.3 and 6.9. The pH of the urine changes throughout the day, with markings being the ideal from 5.8 to 6.8. This change happens to accommodate the foods that we eat, the stress, and the state of our mind. So what if the first morning urine is too acidic? Well, it means that the person themselves, the body tissue, is too acidic. And in an effort to preserve life, the kidney excretes the acidity through the lungs and through the kidneys. The body will die in severe acidosis, so other compensating mechanisms go into play, like phosphorus is removed from the bone to try to neutralize the body. With nothing to hold the calcium in the bone, it falls out. This is free calcium, which deposits in hair, on teeth, and in blood vessels. It also creates osteoporosis and poor bone matrix for the jaw. The pH of the saliva is also important because it's reflective of the lymphatics. When the saliva pH is over 7, it decreases ptyalin production, which means that it interferes with the digestion of carbohydrates. When the blood is alkaline, it's due to acidic tissues in the body. It has a stronger hold on the oxygen, so it's harder for the person to use. If the body is too acidic and the kidneys are working right, the urine will excrete the acid, sending sodium, potassium, magnesium, and bicarb to the blood and the saliva, which will increase the pH. The downside is you can't digest protein, and when the blood is too alkaline, then it promotes more viral growth. Let's talk about carbonated drinks. Sodas are a pH of 2.5, and it would take 30 glasses of water at a pH of 10 to neutralize 1 can. So in an inadvertent way, sodas, even sugar-free, can cause osteoporosis. Tell me what you learned about this particular module. Email me at drdawn@drdawn.net. Let me know who's listening in and if you have ideas or want to participate in adding to our library. Thank you.